Good morning, everyone, and welcome to today's webinar, Planning for Pregnancy, the Do's, Don'ts, and What Couples Should Know. When couples decide they are ready to have a baby, the first thought is usually, now what? Should we just start trying? Should we change our diet? Should we take any supplements? Should we get our fertility tested? And perhaps the biggest question of all, how much should we actually be doing before we start trying to conceive? Pregnancy planning is often treated as something that begins after you see those two lines on a pregnancy test. But there is actually an important phase that comes before pregnancy, where couples can prepare their health, understand their fertility, and set realistic expectations. And that's exactly what we are going to talk today. Hi, I'm your host Soumya, and joining me is Dr. Ratna Durvasula, consultant fertility specialist, BirthRight Fertility by Rainbow Children's Hospital. Today, she will help us understand what couples should do and should not to be doing while planning a pregnancy. Hi, doctor. Welcome to the webinar. It's lovely to have you with us. Before we start into the conversation, I would like to put some house rules. Everybody who has joined us today, thank you so much. You all will be on mute. However, during the conversations, if you have any questions, please feel free to put them in the Q&A section. At the end of the conversation, we will take all the questions and try to answer most of them. So, to start the conversation, also before we begin the conversation, I would like to first start the poll. We have some polls for today. So request all the audience to participate so we understand that you are with us and we would be able to help you sail through that in a very right way. So the first poll that we have is on your screen. You will have 60 seconds to answer them, and then we will reveal the answer and the doctor would take it. So when you are planning or thinking about pregnancy, what was your biggest question? The first is when is it the right time to start trying? What should I change in my lifestyle? Do I need fertility tests? What supplement should I take? How long should we try naturally before seeking help? Okay. So as you can see, doctor, most people that on the screen have picked the second and the last one. What should I change in my lifestyle? How long should we try naturally before seeking help? So to start the conversation with, what is your take on that?
Right. So, how long should we try naturally? So, let's go with that question. And what do we mean by seeking help? Now, fertility has evolved considerably. It's one of the youngest reproductive medicine, as we call it, is one of the youngest branches of medicine. So, previously, getting pregnant was not a big deal, right? But now, we have certain recommendations before you actually even start trying. This comes under the umbrella of preconceptional counseling. Now, why is this so? Previously, there was no big fuss about getting pregnant. You got married and you got pregnant. It was a very natural consequence. Now, with the changing lifestyles, women have now, all of them are seeking higher education, and being a professional is a very important part of a lady's life. So you're having a lot of choices. Birth control became a choice. When to get pregnant has become a choice. Now, lot of things have changed in urban India. There are a lot of changes in the diet, in the lifestyle compared to the previous generations. So what I want to emphasize is you can't take your fertility for granted. just like your mom and grandmom did. It was an automatic thing then to get pregnant soon after getting married. But now things have changed. Therefore, in order to keep up with this and in order not to have disappointments later on, what we call this preconceptional counseling is sort of mandatory if you want to have a smooth sailing. So keep trying naturally by all means, but before you start even planning or fertility health is something that you should keep in mind and get it assessed once. Here, I want to emphasize a fertility consultation does not mean IVF. Please don't have that misconception. We are here as a newer specialty of reproductive medicine to handhold you throughout the pregnancy planning. And there's a lot of knowledge there that has to be explained to you in a proper manner. There is social media, there is AI to guide you through, but we are here to validate the information for you. What is important, we will stress, and then you can have a nice journey while planning your pregnancy. That's,
Right.
I would stop this on. Yeah.
Sure. So, doctor, when we are talking about preconceptional counseling, what includes in that entire counseling? What do the couple come to you and then you talk to them all about?
Right. So first, let's go through the science part of it. And then what is actually more important is your lifestyle. We'll cover bit by bit. So there's a lot of awareness about this thing called ovarian reserve. So what fertility specialists mean by ovarian reserve is that there is a certain fertility potential that is unique to every lady. And not only the lady, here we also consider the gentleman as well. So each couple will have their own individual fertility index or fertility potential. Now, for the ladies, we concentrate on what is called the AMH. So the AMH actually tells you how many years you have to conceive in a manner which is very natural. That is, you won't need help. And if your fertility potential is good, that is, if your AMH level is good, you need not expect any problems, and you can plan your job, your PhD or whatever, and then you can wait for 3-4 years or something more than that if your AMH is normal. Along with that, we see what is called the antral follicle count. So this is by ultrasound, we try to count the number of small follicles in the ovary, and together with AMH and AFC, we can make out a fertility potential that you have. So just let me be clear. Normally, 20 to 30 years, the fertility potential is very good. 26 to 29 years is the ideal age to plan pregnancy. But now with career building and moving countries, moving states, what we know is that demographically, many women are deferring pregnancy into their early 30s, mid 30s, and also to, in some cases, up to 35. Now, these women who are 33, 35, these are the ones who have to really go to the fertility specialist and get your fertility health and your ovarian reserve assessed before you make any decisions about further delaying pregnancy. So here, early awareness about your fertility potential and your AMH level can help you to plan things in a smoother way. That's what we mean by ovarian reserve. Now, one important thing which I want to emphasize is ovarian reserve in Indian women. Over the last 15-20 years, research has shown that ovarian reserve in Indian women is a little less compared to their Western counterparts. Now, let me put it more simply. A 35-year-old white woman, for example, has her fertility potential for another 5 years also. But we have seen that Indian women age faster. The ovaries of Indian women age faster. So it's good to complete your family by, let's say, 33 if you don't want to have medically assisted pregnancies. Why this came into view is all of us have trained abroad, and after we came back to and started practicing in India, what we have seen that Indian women need higher doses, and at a younger age their AMH tends to be a little lower. So this is a generalization, doesn't mean any alarm bells need to be ring. But what I want to say is, if you see celebrities postponing pregnancies to their mid 30s, late 30s, don't think that we can also wait. Each of us has a unique fertility potential that needs to be tested. Especially, we are seeing that in India, unexpectedly, AMH levels are becoming a little less. Therefore, just have a fertility consultation, see where you stand, and plan your pregnancy.
Right. So, doctor, now that we have this entire concept of, fertility, preconception counseling, how
Right.
many women or, the couples do you see walking into your clinic or your hospital asking for such thing? What is the amount of awareness that you see nowadays in the couples?
Right. So the awareness is not very great, Soumya, hence the importance of today's webinar. In a month, maybe we see 3 to 4 couples actually walking in before they plan for pregnancy. Most of the time, we see couples who have tried for 6 months to 1 year and then they want to come to us. But yeah, the right approach, I mean, for us to work with them, it would be better, to see them beforehand, before they actually even plan pregnancy. The awareness is, yes, very less. Yeah.
Right. And
Mm.
also, doctor, there is this thing called 120 days of preparation before the
Right.
conception, right? What exactly does this mean, and why exactly should couples be doing during this period?
Right. So spermatogenesis, that is the development of the sperms, or oogenesis, that's the medical term for the development of the oocyte. It starts actually roughly 120 days before the egg is ovulated or the sperm becomes functional. So this importance of this run up of this 3 months is that you should try to have a very healthy lifestyle. And lifestyle means alcohol, smoking, folic acid supplementation, a balanced diet with all the micronutrients. All this will influence the development of the egg and the function of the sperms. Therefore, definitely 3 months before you're actually planning for pregnancy, you should have folic acid supplementation, should watch the lifestyle, try to get an ideal body weight, and adequate sleep, good hydration. If any immunizations are to be done, they are to be completed. And the roadmap starts of your pregnancy starts actually 120 days before. Now, a lot of in medicine, lot of preventive medicine is now very popular. Like you go for a cardiac checkup, you go for let's say your GIT, things like fatty liver are becoming common. So you keep going for health checkups. All the corporates have this executive health checkup, master health checkup. Similarly, if you have a fertility health checkup, you will identify what is wrong or what needs to be done. So if you do this at least 3 months before you start planning pregnancy, we'll be able to set little sort of fine tune your health. Let's put it that way, fine tune your hormones and see that you have a healthy pregnancy.
Right. You had mentioned about supplements like folic acid and other things, which are mostly used by women. Are there any supplements which are also for men, which they need to try or they need to start before trying to conceive?
Right. See, Soumya, if you have a balanced diet, hmm, other than folic acid, really nothing else is recommended. That is the scientific recommendation. But now we know in this day and age, in urban India especially, people are conscious of their jobs. They have little time to have a balanced diet. So if you are able to have a balanced diet and let's say have adequate amount of protein, fiber, and vitamins from your diet alone with adequate intake of fruits, salads, and all that, actually supplements may not be needed. But seeing people nowadays, the majority of them are not able to devote that much time to plan their diet, their exercise, and all. Therefore, supplements become mandatory. So, folic acid, yes, 5 milligrams folic acid, mandatory. Now, the other thing which we find deficient is vitamin D. Most of the uh, couples are staying indoors, right? And there is lack of exposure to sunlight. So unless you have at least, let's say, 15 to 20 minutes of exposure to sunlight and you're physically active, like you need vitamin D also. So vitamin D supplementation can be taken 60,000 units once a month orally itself. And other things that we would think are antioxidants. Now, antioxidants, diet has a lot of antioxidants. These include traditionally used antioxidants are amla and all the colored vegetables like pomegranates, tomatoes, all the vitamin C rich fruits. All these provide green leafy vegetables, few nuts, walnuts, all these have good antioxidants. But again, if you are hard pressed for time, most of the antioxidant is called CoQ, coenzyme Q. That's what it's called. It's a very commonly used supplement. They use it for anti-aging, as well as it's a pro-fertility supplement both for the ladies and for the gents. You can supplement this, take this as a supplement if you really are not able to have a balanced diet. But I'm for natural things most of the time. So now if you use a little AI, you can find out what are the antioxidants in your diet and include it in your diet rather than taking a supplement. That's where I come from. Yeah.
So with that, I think we will move to our next poll. I think that was a good start for the people to understand how to start thinking about the pregnancy. So the second poll that we have is on the screen. Who needs to, like, basically it's like who needs to prepare? So the question is, who do you think needs to prepare before trying for a baby? Only the women, mostly the women, both the partners, or it depends on the couple? So, audience who have just joined us, you will have 60 seconds to respond to this query, and then we will move to the response. Like we will move to the doctor to answer the question. Right. So, as we can see, most of them have got it right that it should be both the partners. Some people still feel it's mostly women or it depends on the couple.
So, because the
Yes.
audience are well aware of it, absolutely. Just as much as the lady who bears the pregnancy for 9 months has to prepare, the gentlemen also have to prepare, leave the alcohol, leave the smoking, sleep for 6 to 8 hours a day. If you're very sedentary, please get some exercise, have a good water intake, and generally take good care of yourselves in the 3 months run up to planning for a pregnancy.
Right. And, just because a few people have mentioned that it's mostly women, so what role does the male partner play in this entire preparation?
Apparently, it's the woman who's affected most by pregnancy, isn't it? 9 months she bears the pregnancy.
Right.
It's her belly that is going to grow. She's the one who's going to put on weight. So it looks as though the male is not important, but he's the one who is giving the healthy sperm. So a healthy sperm will give rise to a healthy embryo. Therefore, he is very, very important. Of late, we are now identifying that DNA changes in the sperm can contribute to miscarriages also. So there is no doubt that a healthy sperm gives rise to the foundation of a very healthy pregnancy.
Right. So now, if we have to move to setting the expectations right, so it's always said that natural fertility is not 100% even when everything appears normal.
Right.
So could you explain what couples should realistically expect when they when they start to try?
Right. So a very pertinent, important point here is, let's say 100 couples all over Hyderabad have started planning pregnancy. It's only 15 to 20% that are going to conceive per month. So 80% are not going to conceive every month. Now, let's follow these 100 couples further. In 6 months' time, 60% are going to conceive. If we follow them for 9 to 10 months, another 90% will conceive. So after 1 year of trying, we'll have 10% left who are really needing help. So what I want to really emphasize is, please give yourself 3 to 6 months time, and in some cases 9 months to achieve a pregnancy. This is even after a doctor consultation or a fertility consultation that says everything is normal. Now, the scientific basis of this 15% to 20% fertility rate is now very clear once we've started doing IVF. What we see is every egg that ovulates every month is not genetically healthy. So if in a year you have 12 episodes of ovulation, only 3 to 4 months the egg will be genetically healthy. And of all the millions of sperms that gents have, 3 to 4% of the sperm are healthy. So we know scientifically that the human beings are designed to conceive. The fertility rate is slightly low compared to other species. So over 6 months' time, just 60% of you are going to conceive. And over a year's time, I'm just emphasizing, 80 to 90% will conceive, provided there are no major problems. So the takeaway from this natural fertility rate is that definitely have a fertility checkup when you are planning pregnancy. If the doctor said everything is normal, please, you can wait for 6 months at least before you hit the panic buttons. Now, a small rider here. If the ladies are above 33 or let us say around 35 years of age, the natural fertility rates decline a little further. Therefore, we ask them to seek help, medical help, after 3 to 6 months of trying rather than waiting for a year or so. So I hope this clarifies the natural expectations. Do
Right.
not expect a pregnancy the first 1 or 2 months that you try.
Right. And doctor, that you said that 60 to 65 usually conceive within 6 months and 80 to 90 within 1 year. But still there is some people who are left who still are not able to conceive.
Right.
So how do you think, or what is your take on how should these couples interpret these numbers without becoming anxious? What are their chances to conceive even after that?
See, the thing is, if you, this is where the preconceptional counseling comes. If you really understand your fertility potential, you know that realistically, you know what your chances are. So your frame of mind will be very calm and you will be stress-free. And if you have not conceived in those 3 to 6 months, you will have a very good consultation with your fertility doctor. And it will be very black and white. Okay, it's the ovulation that is not happening, or it's the sperms that are not functioning, or it's the tubes are not functioning properly. So these are the remedies that we are going to talk about in each. We call it factor: the uterine factor, the ovarian factor, or the tubal factor, or the male factor. So we have a very clear-cut protocol how to approach a couple who has not conceived in the given framework of time.
Right. So, doctor, moving to the next part. So, if before someone goes for a fertility test per se, can something as basic as their menstrual history give us useful information
Yeah.
on what's the next step?
Absolutely. So when you come for a fertility consultation, first we are just going to talk to you about your lifestyle, your body weight, your habits, and your menstrual history. And later we'll come to the coital history and all those things. But first, let's talk about the menstrual history. So very few ladies have a clockwork-like cycle. So it's not that everyone gets a cycle on the 25th of every month or the 5th of or the 8th of every month. The cycle is variable, and a normal cycle can extend from 25 days to 35 days. So this is the normal variability that we have. A prolonged cycle, let us say 35 days, 45 days, or a cycle that is coming once in 6 months, gives the doctor a pointer that the ovulation is happening a little irregularly. So in a lady with a 30-day cycle, you know that the ovulation is happening between the 10th and 20th day, mostly around the 12th to 16th days, and they can plan very nicely. If they are sexually active in that day 10 to 20-day period, either every day or alternate day, the chances of pregnancy are going to be high. But when a lady who has a 45 to 60-day cycle, it's sort of difficult to plan around a set period, because the ovulation can be happening either on the 21st day of the cycle, on the 28th day, or on the 35th day. So this is where preconceptional counseling helps you to understand that you should be sexually active most of the cycle, or depending upon your cycle length, you have to change the pattern of your activity. Now, important thing is those who are having cycles which are less than 25 days, let us say 21 or 25 days, this is an important pointer to your fertility physician that the ovarian potential is coming down. So what happens when the ovarian reserve is less is the ovulation becomes more frequent and you have shorter cycles, like let's say 21 days, 22 days, 23 days. So we give a lot of importance to the menstrual history, as we call it, to the cycle length. And the second part of it is painful periods. So a moderate amount of discomfort on day 1 and day 2 is quite accepted. You can take a painkiller and proceed with your work. But where the lady is experiencing severe pain that is causing her to take time off work, or painkillers are not helping her, we know that there are some problems like endometriosis or submucous fibroids, or certain problems that may need to be dealt with immediately rather than wait and watch. So if you have either too frequent periods, too irregular periods, very painful periods that are associated with heavy flow and are making you take time off work, definitely, please, you need a fertility consultation and a scan, and just we need to get to the bottom of things. That's the simple truth.
Right. So while we are talking about irregular periods or painful periods or heavy bleeding, so when is it the women should know that yes, you have spoken about irregular periods, you have given us the length of the cycles that one should have, but how about very painful and heavy bleeding? How much is very painful? How much is heavy bleeding?
Right. So again, the index is a pain that is not responding to 1 or 2 painkillers, and that is making you take time off work. When you're not able to do your routine work, you're having to change paths too frequently that you really can't attend your office or your college. You do need to see the doctor immediately. All we are going to do is just one simple scan. It will tell us a lot. Sometimes there is no great explanation for a heavy flow or a painful flow. We can just control it with simple medicines. But sometimes there are important things like endometriosis or cysts in the ovaries, which we need to recognize and treat. So do seek help earlier rather than later. Because again, as I'm emphasizing, preventive medicine is now the current trend. So if we can prevent complications by taking some pointers from your body, it's very good. See, Soumya, what I want to emphasize is the menstrual cycle, the one which is around 25 to 35 days, is a very nicely balanced nature's rhythm. So if it gets upset due to some reason, that too persistently upset, having one irregular period once in 3 months, 6 months is okay. Suppose you've traveled abroad or you've got a fever, or you've used antibiotics for a painful tooth. All these things can upset the menstrual cycle. So a persistent irregular cycle, or a persistent heavy flow, or persistently increased pain in the cycle, all these are pointers that you should attend a fertility physician or a gynecologist and have a scan. This is what I want to take home message from this question of yours.
Right. So with that, I think we will move to our next poll. So for everyone who has joined a little late, we will have another poll and you will have 60 seconds to answer them. So the question for the poll is, how well do you know your menstrual cycle? Uh, just give us a second. The question will pop onto your screen. Yes. How well do you know your menstrual cycle? The answers are, I know my cycle length and track it regularly. I track it occasionally. I know when my period starts. My cycles are so irregular that I can't predict them. So there is no right or wrong answer to it. It's based on your experience so that the doctor can help you assist better. So
Brilliant.
while most of them have said that they know and they track it and they know when only when their periods start, but still the issue lies with my cycles are so irregular that I can't predict them. So what is your take or what is your advice to all these audience, doctor?
Yeah. A big shout out. Very good that most of you are tracking cycles. That's being very health aware. It's very good. To those of you who are having irregular cycles, yes, you need to have a consultation to see why they are so irregular. So, as doctors, we have regularly irregular cycles. Like always, you get your cycle every 2 months. That is not such a great problem, but sometimes you're getting it in 15-20 days, and sometimes you're getting it once in 60 days. You do need a checkup to find out what the hormones are doing. It may not be anything sinister, but we need to know what's going on. As I said, regular cycles are a pointer of good health. Similarly, irregular cycles sometimes are red flags, not always. So it would be smart to go for a checkup and see what's happening with the hormones. Why is it that the periods are all over the place?
Right. I think this is actually interesting because menstrual history sounds very basic, but it actually seems to have an important impact on to understand the entire fertility journey. So
True.
with that, we will move to our next segment, which is like when you have talked about assessing the couple, right? So and when fertility is discussed, it's mostly about women, but you have spoken about no, the couple should come together to get the entire pre-conception counseling done. So what should couple understand about male fertility? And there is something called coital history, semen analysis that we do. So how are they play an important role in this entire process?
Right. So, when you come for a preconceptional counseling or a fertility advice, however difficult and embarrassing it may be, we elicit what is called the coital history. By that, what I mean is how frequently a couple is having sexual intercourse. Are there any problems like erectile dysfunction from the husband's side? That is there a problem with erection or ejaculation? And from the lady's side, is there any discomfort during coitus, after coitus? Or are there any what we call psychosexual problems like vaginismus? That means is it they're sort of very inhibited to have sexual intercourse, or uh, sometimes in this busy day and age, couples are not even having the time and the energy to have sexual intercourse. We call that the libido. Is the libido being affected? So, however difficult it is, we make the couple comfortable, chat with them, and after a little while, we have to go into these aspects because these are the simple things which can be corrected with counseling or a few medications. And this is the actually coital history is the main part of history taking in a preconceptional counseling or a reproductive medicine. I mean, a fertility doctor who's worth his salt will really get into this part and address any concerns because it's very easily addressed sometimes. And no matter what other things you do, if coital history is not right, you can't achieve pregnancy. I think that's very evident. So it's a little difficult in a first consultation to elicit all these details, but it's very, very important part of the history.
Right. For female, it is easy to understand that I need to go see a doctor if it's heavy bleeding, period pain, pelvic pain, stomach ache, anything. But for men, when should they consider coming and getting evaluated?
Right. So, if they are having any erectile dysfunction or a loss of libido or no libido, or if they have had a semen analysis done and it is showing a grossly abnormal semen analysis, it is good to go and consult. You need not come to fertility specialists. We have andrologists, that is male doctors who have a special interest in sexual health and fertility. So you can consult them also, and they will take you through to what the expectations are. And if you have any problems and if you are shared, see, just like Viagra is there for impotence, it could be a small premature ejaculation. It could be a very small problem that can be addressed with tablets also. So you do have to be open to the fact that there may be a problem and we need to consult a andrologist for correction of these problems. I do understand it can be pretty, these are very private details and it can be pretty embarrassing, but rather than thinking and trying to self-treat you with the help of, let's say now AI, Gemini, Claude, so many things are available. Don't do that, because there is a lot of information. I do Google, I do use the AI apps, but not all of them are validated. Your problem is unique to you. So do go and see your doctor and get a proper evaluation and a proper treatment. That's what I mean.
Right. And you, in your previous answer, you had mentioned that due to the lifestyle changes and the busy schedules, couples are not, are not giving time to each other, and the activity, the sexual intercourse, the number of times has come down to a lot. So, what is the usual times that you recommend for a people, for a couple to go conceive naturally?
Right. Swami, another very important point. Here, I'll just take a step aside from fertility and want to let you know that physical intimacy is part of a healthy marital relationship. You don't start thinking and getting hyper about physical intimacy just when you plan a pregnancy. See, 20 years ago, there were not so many diversions like so many video games or so many channels streaming movies, and you were not stuck to computers throughout the night on meetings, and you had now you have deadlines. And so you're stuck to your screens throughout the day and sometimes well into the night, and you're exhausted. And we know that after taking so many histories, we know that sexual activity has actually come down in urban India. And that is also leading to the problem of fertility. So when a youngish couple comes to me, this is what I tell them. Do not link sexual activity to pregnancy alone. Being physically intimate is again a part of a healthy marital relationship. So do make time for yourself to be sexually active most of the time, except when there is menstruation or you're not well or something like that. Now, coming to fertility, what happens is if you try to focus the physical intimacy or sexual activity only around the fertile period, it leads to erectile dysfunction, psychosexual problems. The gents get impotent, the ladies, the natural secretions get down, so they have coital problems, coital pain. We call that dyspareunia. They have pain during intercourse. So the whole thing gets messed up. So again, at the cost of repetitive, I'm saying you should be sexually active most of the time. Make time for each other. If it is such a problem, then yes, be guided by the doctor to be sexually active during the time of ovulation. Now, again, this varies with the time of your cycle. For a regularly menstruating lady who is having periods once in 30 days, it is day 10 to 20. For those with irregular cycles, they need help either with ultrasound monitoring or urinary LH kits. There are devices to help them. But again, it becomes stressful once you go down that route.
Right. So again, moving back to where we had actually started is like you had said that there are some tests that nobody should feel ashamed of coming to the doctor and getting themselves tested or checked. It is better, it's always prevention is better than cure. So if there is a standard checklist for everyone that you would suggest every individual should be getting, so what are those investigations or the tests that you would suggest these couples?
Right. For the ladies, we always do a hemoglobin, a complete blood picture, because iron intake is usually less in India, and we try to build up the hemoglobin with just iron supplementation if it is less. Now, the other very important test is TSH, thyroid hormone evaluation. Again, it has become a very common problem. Thyroid problems are very commonly being identified nowadays. There is a bit of a misconception about these also. So somebody, the mother or the aunt says, if you start taking thyroid, you have to take it throughout your life. The doctor will say that, but don't start taking hormones. So a lot of misconceptions around it. But as a gynae endocrinologist, what I want to say is, supplementing a thyroid hormone when it is deficient in the body is something very simple. You need not be sort of ashamed or feel inferior just because you're taking a thyroid tablet every day. It is just like we giving B complex tablets if your B12 is low, or giving iron if your hemoglobin is low. So please don't be afraid to take a thyroid test if the doctor has prescribed it for you. Now, the second important thing, you know that India is now the diabetic capital of the world, and a lot of young adults are also being diagnosed with diabetes. Again, the one test that is there is called HbA1c, that estimates the glucose level over the last 3 months. So that as a screening test is very important, more so if both parents are diabetics and there is the BMI, we are overweight, or if you're not feeling, you're having recurrent infections for whatever reason. These two are the tests that are routinely recommended, a TSH and a HbA1c, to those who are planning pregnancy and those who are not planning pregnancy as well. In urban India, very, very important tests are these two. Now, to go a little into the details, for the ladies, we also recommend what is called a hemoglobin electrophoresis. So everyone knows now there's a lot of awareness about thalassemia, sickle cell traits and all this. So again, if we screen and if they are not there, we are very happy. But if they are there, the appropriate advice will be shared to you. Now, other thing is, we'll talk about consanguinity now or a little later. Genetics and genetic counseling is also a very young branch that is gaining importance along with fertility. So, in a lot of Indian families, especially in the South, cousins get married. So, we know that sometimes, even though we appear healthy, we may be carrying defective genes. So, by chance, if two family members who are carrying the same defective gene, they get married, they're going to have children with abnormal genes. So something that has been coming down with tradition, that is marrying within the family, now we know is not such a great idea. But if there is a couple who have married within the family, it would be very nice to go for a genetic counseling. And if everything is normal, I'm sure they'll have healthy kids. But if there is a problem, we will be forewarned. We'll be able to detect it and guide the couple.
Right. So these are some of the things that you have said, which are very obvious. Then comes the less obvious things, like there's also this conception that uh, cosmetics can also impact can be endocrine disruptors. So how do couples pay attention to these environmental exposures while they are planning the pregnancy?
Right. So if you if you visited any of the branches of Rainbow for an IVF cycle, it will be clearly written, no deodorants, no perfumes, no cosmetics. And this is for both the ladies as well as the gents. Now, let's go into why we ask you to avoid them. There is this chemical called phthalates. Phthalates are endocrine disruptors. So these phthalates are present in all the cosmetics and in some of the plastic containers. So reheating food in plastic containers is not good. We'll go into this a little bit later. So what these phthalates do is they imitate the function of the estrogens and the testosterones, and they mess up the balance. So the body reads signals as today, if there's a lot of exposure to let's say a particular perfume or a deodorant, the body gets confused. Something is wrong with the estrogen level in the body, and the hormones go bizarre. So this is why we say control the exposure to phthalates wherever you can. One of these is the cosmetics. Now, the other major thing where we call these biosimilars, which are present in the food. So you have pesticides and you have fertilizers and you have many other industrial pollutions, so many things that are there in plastic, water bottle, whatever. All these things are adding up in the body, microplastics, and all these are messing up the endocrine hormones. Not to be an alarmist, but we know for the last 20 years, sperm counts have been declining all over the world. And similarly, the PCOS under the new name of PMOS is being diagnosed more and more across the world. And also in the younger girls. We are seeing girls with hormone problems as young as 9, 11. So alarm bells are ringing all over the world. You know that obesity has become a major issue across all age groups. 1 in 4 young adults in urban India is having a BMI that is more than normal. So multiple factors have come into this endocrine disruption. So the reproductive hormones have gone for a toss with the modern lifestyle. And this is something which can be addressed from the root cause. So start making small changes in your diet, in your lifestyle, in your exercise, so that you don't have to go for major treatments.
Right. So I think, Doctor, due to paucity of time, we will have to move to the audience questions. But before we move on, if there is anything that we have not, I mean, I have not able to answer, and that is very important for our audience to know, if you could just shed some light on all those points, please.
Yeah. One thing I want to say is don't get stressed when you're planning a pregnancy, and don't compare yourselves as a couple to another couple's journey. You are unique, and you and your husband make a unique couple. So your fertility and your time to pregnancy will be your own. So by comparing yourself to others, you're only increasing the stress. And again, as Soumya has brought out some important facts, there are timelines for everything. Give yourself some time, realistic expectations, and don't get jumpy or let's say don't
Anxious.
get anxious if you're not getting there. There are so many doctors to help you. Just go for a consultation, reassured. One more important thing is stress and mental health. Mental health has also gone for a toss nowadays. Social media, stress at your job, AI, so many things have contributed to stress. Don't be afraid to seek the help of counselors, psychologists, therapists, whatever you call them, and get your mental health also in order. Be in a happy place when you're trying for pregnancy. Don't go in with a bunch of anxiety. If you're having any stress issues, especially with mental health, depression, anxiety, you're overthinking anything, do talk to counselors. I understand now every company also has psychologists on board. So it's nothing wrong in talking to people to get better. Previously, the family members used to act as counselors. You had extended family. You had sisters-in-law, you had uncles, you had aunts whom you could share your problems with, cousins. Nowadays, everyone is busy, and it's often that, just the husband and wife are staying together and the stress builds up. So do take counseling, whether it's from family or from therapists or psychologists. Taking help for the mental health, always a right thing to do.
Right. Thank you so much, doctor. So now we will be moving to the questions that we have received from the audience. We will try to answer as many as possible. Some of you have posted questions which are similar to each other, so we will answer all of them together. So the first question, doctor, is me and my husband got married 2024 December. Since then, we are trying to conceive in process until 2025. She got pregnant in May month. But when we tested for pregnancy kit, it tested positive, and the next heartbeat, there is no heartbeat. Abortion done. Second time also conceived in last year September. Same for 11. We listen heartbeat, and after 14 weeks no heartbeat. Why it happened? Why we don't do you can you please help us that why it is happening is mostly
Right.
the question.
So we have a name for this. This is called recurrent miscarriage. There are 3 or 4 known causes for recurrent miscarriage. One is that there could be a genetic defect in the embryo. Another is there could be a hormone deficiency. Third thing is an abnormal uterine shape. And the fourth thing is the blood supply to the baby is not going well. So if you attend if you have a consultation, we'll try to find out the cause and then treat you appropriately. Nothing to get very stressed about.
Understood. So the next question is, what are the precautions that needs to be taken if husband has some autoimmune disease, SAPHO? Is it safe to get pregnant?
So if the husband is having an issue, we'll do some tests on the sperm. Other than the regular semen analysis, we would also do the DNA function of the sperm. It's called DFI or SCST. That is, we test the sperm for actual DNA damage. And if they are good, we can go ahead and treat them. No problem.
Understood. The next question we have is, I have autoimmune thyroid disorder called Graves' disease. Can I conceive naturally?
Yes, you can. Provided the Graves' disease is under control, you can have a perfectly normal conception and a normal pregnancy. But yes, you do need to be supervised by the endocrinologist throughout your pregnancy.
Got it. Then the question comes, my natural menstrual cycle is 22 days. Do I need to check with a specialist?
Very much. You need to get an AMH done ASAP and have a fertility consultation.
Okay. I have 2 failed IVF cycles with borderline low AMH, and my husband has OATS. Is IVF the only way forward? We are 33 and 38. What do you recommend, ma'am?
I would recommend a detailed fertility consultation. It's not that hope is lost. We have several different regimes which we follow, which are customized to each couple. So please, I'm sure we can help you by altering the approach to IVF.
Sure. The next question comes, does anxiety medication in male affect conception? We are planning for second child. Please guide.
Anxiety medicines may affect the sexual performance, like frequently they give rise to ejaculatory dysfunction or impotence, but they will not affect the conception per se. So if the couple is having problems, we can think about intrauterine insemination or something on those lines. Anxiety medications, by and large, are quite safe.
Okay. Is DFI the test to know the genetic status of sperm?
DFI is the DNA fragmentation index. It tells you partly about the DNA, but not the entire genetic history of the husband. So that is called a chromosomal microarray that is done with the blood of the husband, not the sperms.
Okay. My cycle date is 28 to 30, but flow is very low. Only first 2 days, that's also very low.
The flow is not a very reliable indication of your ovarian health or reproductive health, but you would do need a scan to identify the thickness of the endometrium, that is the lining of the uterus, to see why you're bleeding less.
Right. And does that have any effect on her pregnancy?
Sometimes, if the endometrial lining is very thin, it can result in miscarriage. But again, we can give a few tablets to increase the thickness. We give estrogen tablets to increase the thickness, and that should solve the problem.
Okay. The next question is, I got married in November 2024 and got conceived in July. Then in August 2025, I got abortion, and from then I am trying not to conceive. Till then, what to do? Please suggest.
You can use some contraception like oral contraceptive tablets, and then plan your pregnancy whenever you feel like it.
Okay. We are getting an overwhelming response on the questions, but because we are already beyond the time that we have scheduled, so we will take all these questions and try to respond to them. So, Doctor, thank you so much for joining us. That was a great way to bring together some of the most common assumptions around fertility. So I hope we have tried to respond to most of the queries, and doctor has tried to answer to whatever you had it in your mind. So for most of the couples, please remember that it's different for each other. So you cannot compare your cycle with others. So please understand. Please go and get it checked. Thank you so much, Doctor, for joining us. It was Dr. Ratna Durvasula, Consultant Fertility Specialist, BirthRight Fertility by Rainbow Children's Hospital. Thank you, Doctor, for taking our time. It was great having you today.
Thank you.